In Part 3 of the Medi-Cal webcast, we are going to talk about Medi-Cal programs for families, children, and pregnant women. When working with families with children, always look first to programs that will cover as many members of the family as possible. The programs for families cover parents or caretaker relatives as well as children. This makes them preferable to programs that only cover the children. The greatest number of families and children who are on Medi-Cal qualify for the program through the cash-related categories. Calworks is California's Temporary Assistance for Needy Families, or TANF program, for providing financial help to low-income families with children. With certain cash assistance programs, such as Calworks, beneficiaries are also entitled to full Medi-Cal without a separate application. The entire family under the Calworks grant is entitled to full Medi-Cal as long as the family is receiving at least $1 of Calworks assistance. Another program that is in the cash-related category is Supplemental Security Income, or SSI program. If, for example, one of the children in the family has a disability and is receiving SSI, that child receives full Medi-Cal with no need for a separate application. Foster care and adoption assistance are other examples of cash-related categories. Children who are receiving foster care or adoption assistance automatically receive Medi-Cal. Also, refugees and asylees who are receiving refugee cash assistance during the first 8 months that they are in the U.S. receive full Medi-Cal benefits. Under each of these cash-related categories, the beneficiaries are entitled to full Medi-Cal with no share of cost. We will discuss share of cost briefly later in this video training. The largest program for families with children is the Section 1931B program, which covers most Medi-Cal beneficiaries in the state. The reason that this program has an odd name is that it refers to the section of the Social Security Act, 1931B, where this program is described. Under the Section 1931B program, families with children are entitled to full Medi-Cal with no share of cost. All Calworks beneficiaries are included in the 1931B program. However, a family need not be receiving any Calworks in order to qualify for this program. This program also covers many working poor families. Under the 1931B program, it is important to determine whether a family qualifies as a recipient or as an applicant. A recipient is someone who is enrolled in Calworks or 1931B or could have qualified for Calworks or 1931B in the past 4 months prior to the month of the Medi-Cal application. Note that a person need not have been receiving Calworks and need not have been in 1931B in order to be considered a recipient. A family need only have been eligible for Calworks or 1931B in one of the past 4 months prior to the application. If a family can qualify for the program as a recipient, then they are entitled to more income deductions, better income disregards, and easier rules to qualify for the 1931B program. Medi-Cal is not concerned about the number of hours that a recipient family's primary wage earner works. However, an applicant family is limited in how many hours per month the primary wage earner may work before the family would lose Medi-Cal eligibility under this program. This rule is called the 100-hour rule. The rule comes from the former AFDC program. Under the rule, the applicant family's primary wage earner may not work more than 100 hours in a month to remain eligible for this Medi-Cal program. If a family loses eligibility for Section 1931B because of increased countable earnings, then they can be eligible for the Transitional MediCal program. Transitional MediCal is for all families who become ineligible for Calworks or Section 1931B MediCal due to increased countable earnings. If a family becomes ineligible for Calworks or 1931B due to increased earnings, This program provides full Medi-Cal coverage for up to 12 months. They need not have received Calworks or 1931B consistently in prior months. Rather, they only need to have received Calworks or 1931B for 3 of the previous 6 months before losing benefits altogether. If a family qualifies for Transitional MediCal, they continue to receive Medi-Cal for the first 6 months regardless of how much the income increased. So in fact, the wage earner in the family could get a very good job, and the family still could continue to receive full Medi-Cal for 6 months. If the family's countable earnings are no more than 185% of the federal poverty level, the family may continue to receive Medi-Cal for up to an additional 6 months after the first 6-month period. The Transitional MediCal program, like the 1931B program, has no share of cost for beneficiaries. Another similar Medi-Cal program is for families who lose Calworks or 1931B due to an increase in child or spousal support, instead of due to increased earnings. If a family loses eligibility for Calworks or 1931B because there is more child or spousal support being paid to the family, then they can continue to receive full Medi-Cal for 4 months. The family must have received Calworks or 1931B during 3 of the last 6 months before becoming ineligible in order to qualify for the 4-month continuing eligibility program. Under this program, there is no share of cost. Regardless of how much more child or spousal support they are receiving or the family's income, the family may still continue to receive Medi-Cal for the 4 months after losing Calworks or 1931B. Always try to qualify a family for Section 1931B or Transitional MediCal or 4-month continuing eligibility Medi-Cal, because under those programs, both the parents and caretakers and the children can be covered by Medi-Cal. If, however, a family cannot qualify for one of those programs, then look at eligibility under programs that cover only some family members. Look first at programs that cover the children in the family. If a woman in the family is pregnant, there are programs that will cover her and a newborn child. If a family member has a disability, please be sure to view the video training Part 4, which covers programs for people who are elderly or have a disability. The primary programs which cover only the children in a family are the Children's Federal Poverty Level or Percent programs. Each of these programs covers an age range of children in families up to a certain percent of the federal poverty level. An infant from birth up to age 1 may be covered in full Medi-Cal if the family income is no higher than 200% of the federal poverty level. An infant born to a woman on full Medi-Cal is deemed enrolled in this program without a separate application. Once the infant turns age 1, she may have Medi-Cal coverage until her 6th birthday, as long as the family income is no higher than 133% of the federal poverty level. After that, once that child reaches age 6 and until her 19th birthday, the child can continue to receive Medi-Cal as long as the family income is no higher than the federal poverty level. With each of the poverty level or percent programs, there is no share of cost. There is also no property or resource test for these programs. This means that Medi-Cal will not look at what property or resources the family owns. It is also important to note that there is no deprivation requirement for these programs. Under old welfare and Medi-Cal rules, for a child to be eligible for Medi-Cal, the family had to show that a child was deprived of one of her parents, and that is no longer a requirement for these programs. If a child is not eligible for one of the programs discussed up to this point, look at whether she may be eligible for the Healthy Families program.